Good afternoon, everybody. Hope you're hunkered in. It's Wednesday, but fairly cold and getting a little more brutal by the moment around here. But before the day is ended, I thought I would go ahead and do a quick video for us for Wisdom Wednesday. And I'd planned on continuing with my hallmarks of aging and kind of walking through each of those in a little more depth to help us understand that. And particularly now I'm listening to a new book that Tony Robbins and some other medical folks have just released called Life Force. And there's a lot in that book, and I'll have more of that next week. But I've had several discussions with patients and some folks who have wanted me to do a little bit of review and perhaps help with folks who are dealing with long COVID symptoms. So I thought maybe I would just take a break and address that, if you will, for folks who are still struggling with some of the symptoms with long COVID, or you may have family members or friends who are still dealing with some symptoms, whether it be pulmonary or gut issues or fatigue issues, or just continued with some upper respiratory type symptoms. And I want to approach this from just folks who are at home who really are not that sick, but just not well yet. And looking at things that we can do that do not require pharmaceuticals. And then if we need some pharmaceuticals, certainly I'll address that as well. But to start off with, just continuing with your vitamin C, continuing at least 500 to 1,000 milligrams a day. And if you can tolerate more, I would do a little bit more of the vitamin C in terms of just bolstering up your body's ability to utilize that as a major antioxidant in the body. It won't hurt if you tolerate cod liver oil, because that also has some vitamin A in there. And I like to keep some in my refrigerator and just take a spoonful daily if I'm not feeling well. There's a reason that moms used to keep that around. It's not particularly palatable, but it's certainly manageable and something that might be of great benefit to you. In addition to both the fish oil, vitamin C, and or cod liver oil, then I would also look into taking some vitamin D. And I know that we've talked a lot about vitamin D, but it won't hurt to just sort of overdo it for another week and bump that up to 10,000 international units a day if you're not taking it already, and continue to keep that vitamin D level up. And if it continues, then you might want to consider discussing with your provider, whether it's our office or someone else, perhaps a round of some steroids that may be just a short either Medrol dose pack or a little prednisone for 5 to 10 days. After that, there are some other things that can be done that stabilize what we call mast cells. Mast cells are the cells that release a lot of histamines. So we have histamine 1 blockers and histamine 2 blockers. We've talked about those. The histamine 1 blockers are the medications like Zyrtec or Claritin, things like that, that you can get over the counter. And next we have the H2 blockers, which are more the blockers of stomach acid. And there we're looking at famotidine and nitrazidine. And those can be just, again, over the counter. That's your Zantac and or Tagamet, things like that. So both of those, one of the H1 blockers or one of the H2 blockers, actually both, one of each, I would say. And then there are other supplements, the quercetin and luteolin. Both of those are also anti-inflammatories, antioxidants. The luteolin 100 to 200 milligrams a day, and quercetin 250 to 500 milligrams once or twice a day. Also, you want to kind of heal the gut again in terms of replenishing and healing the microbiome. So either multiple types of probiotics with bifidobacterium and lactobacillus, in addition to looking at fermented foods, things like kefir and probiotic type yogurts. I do know that you can get some of the better ones over the counter are going to be that you just get at the grocery store if you don't make your own, would be those that are just plain, that aren't fluffed up, and that have cultures in them still. Most just yogurts with multiple flavors and fruits and things in them really don't have a lot left in them by the time they reach the market. So you might look at some of the ones that are plain, the Belgian type yogurts, and some of the Greek yogurts may have a little bit more in the way of fermented probiotics still available in that food product. After that, I think the other thing is just not to overdo it and allow your body time to heal. Look into some mindful work, some behavior modification type things that will help you. We want to optimize sleep so that recovery can occur as well. And if things continue to progress, looking into seeing a pulmonologist for pulmonary function tests, doing some brain work in terms of whether or not you might need to have an MRI or some potential therapy for cognition type evaluation, because we know that a lot of folks really just seem to have a lot of brain fog. But hopefully with kind of cleaning up your diet by eliminating a lot of the sugars and really trying to sort of do a little reset of your body in terms of eliminating inflammatory type foods and taking these anti-inflammatories, these mast cell type stabilizing medications, the H1 blocker, the H2 blocker, the quercetin, and the luteolin. These are all stabilizers. They're antioxidants. They help with a lot of the inflammation, and you don't want to continue to contribute to it. So that's why the nutritional program can be helpful as well. And then if it persists beyond all that and you're still struggling, then I would definitely talk to a care provider and looking into things that might be helpful from a prescription standpoint. There's no clear-cut endpoint here. It's just really, when do you feel better and when do your symptoms start to abate and things start to clear up. Most people within a month do feel much better, but as you know, and as we all know, we have a few folks who just really continue to linger on, whether it has to do with the infection and or even some people with the vaccine. So I hope this has been somewhat helpful for you. If you continue to have any problems or would like to have further information, I would talk to your care provider or talk with us, and we'll be happy to help you pursue any other types of follow-up. You all get home and stay off the roads if you don't have to be out there. And if you do have to be out there, just go slowly and be mindful of everything around you, and hopefully we'll be able to avoid any types of issues out on the roads, because it looks like it's going to be fairly tricky the next 24 hours or so. You all have a great rest of the day, and we'll talk again next week.